guys, my name's Jay. Welcome to Hunter Allied Care. Coming in my setup for a patient.
Cool, thanks for having us. What's your role here?
So my role, I have two roles. One is owner, which is kind of overseeing everything to do with the business, and the other is physiotherapist.
What does it mean to be a physiotherapist?
So to be a physio, the kind of overarching idea is that you're helping people to increase function and quality of life, but it can vary in terms of what you do for that. So you can work in cardiopulmonary physio, which is typically in the hospital. You can also work in neurological physio. It's also typically a hospital kind of setting where you're dealing with a lot of rehab or stroke, spinal cord injury, this type of stuff. Or you can work in MSK, which is musculoskeletal physio, and that's this type of setting.
So what issue is your next client coming in for?
So my next client's coming in with chronic lower back pain. So we'll be going through a few different things in terms of exercise and education.
What did you study at university?
So it took me a little while to get into uni. I did 2 years of remedial massage after school and then applied and still didn't get into physio. And then I did a year of occupational therapy and had to finish with a distinction average to then get into physio, which I did.
What theory was included in your degree?
So the degree itself has a fair bit of theory. There's a lot of stuff that's outdated, but that's now coming up to speed with where physio's at. We cover cardiopulmonary physio, neurological physio, musculoskeletal physio, and then you do a lot of biomedical science, which is a bit of biology, a bit of chemistry, anatomy, physiology, which at Newcastle University where I went, they have the wet labs, which are the cadavers, so you can learn hands-on with people who have donated their body to science. Yeah.
What's this diagram here?
So this is trying to explain pain to a patient or try them to help them understand what pain is, and that it's not just something structural, that it has to go up to the brain to be perceived. So that is what we're trying to explain in this image.
You have to complete clinical placement with uni. Where did you do this?
So at uni you do prac the whole way through the physio degree. Part of it's in your first year and second year, but there's not a whole lot. The majority of your prac happens in third year, you do 5 weeks, and then in fourth year you do 20 weeks, 4 5-week blocks. And so one was at John Hunter Hospital doing cardiopulmonary, then I did rehab for neurological rehab, and then I went through and did just a MSK practice in Sydney and finished up in a Glen Innes type of hospital setting there.
So do you only work with athletes?
No, so it's a common kind of misconception that we do, though in this setting you can work with athletes, or if you wanted to be a sports physio, you can work with athletes and be, say, the physio for the Newcastle Knights, whatever else, though it's probably a very small part of physiotherapy. The majority is in the hospital setting or dealing with all kinds of people in this setting.
Why did you choose to work in private practice over somewhere like a hospital?
So I chose private practice as, one, because I could kind of be my own boss and create my own business and be innovative in the field, and the other so that I could see chronic pain patients as my primary patients that I'm seeing, which is a lot of in private practice.
What does it mean to work in early intervention as a physiotherapist?
So early intervention is catching people early. So it's not always super important. If somebody sprains an ankle, it's not a huge concern that you catch them super early. Though in this type of setting, in chronic pain, you want to get people before they've seen somebody else and develop some beliefs that might be misguided or potentially have changes that are happening in their nervous system from being in pain for so long. So you want to try to get those people pretty early on in their rehab.
What conditions might this include?
So chronic pain, there are 3 areas that are kind of really common, which is chronic lower back pain, chronic neck pain, or CRPS, which is limb pain. And then within those areas, there's kind of different things that you'll see. Chronic pain typically means that the pain's gone on for longer than 3 to 6 months, and those people have been seeking treatment but not getting better.
What are these rooms over here?
So this is our massage room, and it's also a physio room that we can use, but it's primarily used by our massage therapist doing remedial massage. And then our second room is a physio consult room that I treat out of.
What's a common misconception people have about physios?
So I guess the biggest misconception is that physios will fix you. Physios won't fix you, but they'll teach you how to fix yourself. So as opposed to coming in and getting massage, you might get massage, but you'll primarily get education and exercise on how to fix yourself.
And one last question, what advice would you give to someone looking to become a physiotherapist?
My advice would be to do it. It's a really rewarding career. You can go in so many different fields with it amongst the 3 different areas of physio. You can make a big influence on people's life and function, and it's endless jobs in physiotherapy as well. You'll never be out of work.
Cool, thanks for having us.
Cheers, see you guys.
Bye.